hands where they don't belong. That's gonna leave a mark. And what not to do with a hammer. In honor of the new series Original Sin, today we're breaking down and reacting to some of the disturbing medical scenes and injuries from Dexter.
Surprise, mother.
Let's dive right in. Oh, so classic of Dexter. It almost looks like a 10 or a 15 blade that he's using. Basically a scalpel, but there's different shapes to them. That type of cut in general, it's super sharp, so it's really easy to close up. It will probably heal really close, like a paper cut, so to speak. Dexter here has his own kind of PPE. We use similar things. The face shield is quite similar. We have a mask with a shield. We don't use the aprons, but we use sterile gowns. Oh, hammer.
Pick up the hammer.
We do get hammer injuries, traumas from people hitting their hands. But we've also, unfortunately, seen where people use hammers as objects to hurt each other. I've definitely seen some head injuries related to it. The back part of the hammer, a little bit more sharp, so to speak. If it's into the brain, depending on the frontal lobe versus deeper and multiple strikes, we'll see people who come in with hematomas, contusions, or intracranial bleeding, a subarachnoid, a subdural, or just destroyed brain tissue. And if there's likely destroyed brain tissue, there's really not much for us to do.
Hello?
Dexter, I need you to go to an all-night pharmacy right away.
I'm kind of in the middle of something.
Sometimes I will answer the phone when I'm in the middle of a procedure at work. I don't know the number, but I need to answer it. All my work calls go through our cell phone as well. If they just don't have my cell phone number, they have a different work number that gets transmitted into my cell phone.
Oh, Harrison has an ear infection. He's in a lot of pain, Dexter.
Right, my mistake, I wasn't thinking. I'm on my way.
Harrison has ear infection, his son. Ear infections stink. They are very painful. It's swollen tissue that's supposed to move when you hear. It also has to do with a lot of inflammation just in and of itself, and it's very innervated there, so you feel it a ton.
For the good of the family.
Oh, it looks like he's going closer to the left side of the heart. You're gonna leak a lot of blood out into the mediastinal cavity, and then eventually you're gonna bleed enough to where it's not pumping out blood to the rest of your body, or it's gonna compress down and not be efficient anymore.
Well, I'm real sorry for you, boss, but your dead wife can suck my.
Oh, that's not good. Oh, that's a bad device. Oh, I'd see people headbutt each other. I don't know if it's like the smartest thing in the world to do. Everybody says the bone in your forehead is super thick. Yes, it potentially is. But remember, you have your frontal sinuses here, which actually is thin bone because it's got air in between it. Dexter getting splashed with the red stuff all over his face. In your face! Now you have body fluid exposure. We're worried mostly about bloodborne pathogens like HIV, hepatitis B and C.
No, I'm here to kill you with that pen.
Whoa. Hard to tell if it's an injury to his left shoulder or left chest, but more likely it's going to go into the soft tissue. Potentially, if it's more anterior chest wall, there's always a risk of trying to go into the lung. You'd have to have a lot more force to be able to get there. Oh, he's going directly into the major vessels of the left side of the neck. Carotid artery and your jugular vein, you have it on both sides. You have the sternocleidomastoid that sits over top, and underneath that is where those big vessels run. Yeah. So actually they're doing a pretty good depiction of it. Very dark blood, so this is probably venous blood. This is most likely the jugular vein just bleeding out. What he's experiencing, potentially getting lightheaded, dizzy, but would you pass out? Would you succumb to the injury super fast? Probably not. You have 10 to 12 pints of blood. For you to potentially pass out, you need to probably lose about 25 to 30% of your blood volume.
Friends forgive.
But I don't forgive you.
Oh.
I don't get to have friends.
Oh, usually he uses a blade. Interesting.
You're a little freak.
Strangulation type injury, which we do see often in the emergency department and do have to rule out any major injuries. You can see petechiae or bruising to the neck, and we will do a CTA of the neck.
You think I'm done with you? You think this ends here? It doesn't!
Then we want to look at the airway and make sure that there's no damage. Make sure there's no fracture of any cartilage, and we're making sure the hyoid bone looks fine. Looking to make sure the spinal cord looks fine and the bones around the cervical spine. We're also looking at the major blood vessels, hence the A part of the CTA.
It does for you.
Wow. Getting both their major vessels compressed down as well as the airway being compressed down. So those are two ways that somebody can potentially pass out. So you're not getting blood flow going into the brain via the arteries or blood flow out, and the decrease of oxygenated blood in will cause you to pass out. Oh. Did he snap his neck? You can have a high cervical fracture from twisting really hard on somebody's C-spine, but it's got to be high so it's closer to your brainstem. So it stops all that information going to innervate your body to breathe and have your heartbeat. So the diaphragm's going to stop. Your autonomic nervous system is going to be interfered with. Oh, Miami Airport. Oh my gosh, how often do you get mad when you see a closed bathroom and you need to go? The closer you get to the bathroom, the more you feel like you gotta go, and that has to do with your body's like nerve impulses that you're about to cause a relaxation of your sphincters, so that way you can decompress your bladder and let things out.
Excuse me, sir, I have your wheelchair.
I don't need a wheelchair.
Oh, the classic Dexter injection of medication. If you're looking for a legal, non-prescription way to knock out at nighttime, you should try Do Not Disturb by my company Life Happens to help you drift off to sleep naturally, no needles, and no neck trauma required. Find it at lifehappens.com or on Amazon. We don't like when people are in that position where their heads are down like this, because they can occlude their own airway. That is why when you do like CPR and you're doing rescue breaths, you either do a head tilt chin lift technique or you do a jaw thrust, because you want the airway to be open, or the jaw thrust when you actually grab the angle of the mandible and pull forward. I've had many cases over the years where people have difficulty breathing and you put them on a BiPAP machine, which is that mask like a CPAP. They're so weak and tired that they start occluding their airway, and they're going to start retaining CO2, becoming more altered, so you actually need to intubate them.
It never matters your destination. The smart traveler must be prepared to make last-minute adjustments.
The wheelchair did not have the wheels locked. You want to be really careful when you're transporting people and trying to put them in a wheelchair, because it can go out from under them and they land and hit their buttocks, hit their tailbone, or go all the way backward and crack their skull open. I am a fan of Dexter. If you guys enjoyed this, definitely check out this playlist right here. Binge watch everything. Please make sure that you subscribe, turn on your bell notifications, and hit that like button for me. Thanks so much for watching, and stay healthy, my friends.